Good evening, everyone. I'm saying good evening because I'm talking to you all from and introducing this webinar from Bangkok. But good morning to all of you, all of those of you who are joining today's webinar from North America and other parts of the world. Thanks for joining the webinar on strengthening supervision for the social service workforce. I'm really excited to be moderating this webinar and launching the supervision guidance document for the social service workforce. So for me, this is an exciting day, and I think for the Social Service Workforce Alliance as well. This is the 38th webinar hosted by the Social Service Workforce Alliance. So we're proud of that, that number, and we're proud of that pattern. Today's webinar and the guidance manual we're releasing is an outcome of collaboration with Primero and with UNICEF, and is also made possible through the generous support of the American people through the USAID under the Partnerships Plus cooperative implemented by JSI Research and Training Institute. So the webinar is being recorded, and the recording and the full presentations will be shared this week. Can I ask you all, when you have questions, I think you should see a questions box, but if you don't, if you have questions, then please put them in the chat box. So next slide, please. So yeah, I'm Jane Calder. I am co-chair of the Supervision Interest Group that's been working on this document, this guidance document. I'm also a steering committee member of the Global Social Service Workforce Alliance, and I work for Save the Children as a Senior Child Protection Advisor, Asia and the Pacific. So I'm just going to introduce the agenda for today. So we're starting with me and an introduction to the guidance manual and some introductions to the presenters on the webinar. So I'm really delighted to be introducing three other presenters. We have Kelly McBride, who's going to be presenting on the missing link, an integrated model for supervision. Kelly is leading on an integrated model for supervision. So the work we feel is very complementary with what we've been doing. So exciting to have Kelly on the call. Then we have Sazan Baban from Save the Children Myanmar. Sazan is currently the Child Protection Case Management Advisor, and she's going to be talking about using a competency-based approach for social service workforce strengthening in Myanmar, with a particular focus on supervision and the competency-based approach to developing supervisors' professional competence. Then we were due to have Amy Amburn, who is leading the lead for leadership development, coaching and training in Montgomery County Children's Services in Ohio in the USA. Unfortunately, Amy's unable to join us. She's had a bit of a clash, a travel issue, so she's very disappointed not to be joining us this evening. And then we have James Gatui, who's with the Mwendo program in Nairobi, Kenya. And James is going to be talking about the coaching and mentorship of the social service workforce for improved OVC outcomes. Lastly, in terms of the webinar agenda, but most importantly, really, is the questions and answers. So we've asked our presenters to be strict about time, and we really do want to leave a good amount of time towards the end for questions and answers. So we'll get started. So the development of the guidance. So just a little bit of history here. The Supervision Interest Group was established by the Global Social Service Workforce Alliance in March 2020. I'm hoping that many of you on the call were actually part of the Supervision Interest Group. We did have 64 members, which is an impressive number for a special interest group. Those 64 members came from 33 countries across the globe and across stakeholder groups, and included members from both the development perspective and humanitarian. So having 64 members, we did decide to divide into subgroups, and so the subgroups that we divided into in order to develop, in order to work on the guidance document, they focused on planning for supervision, and then developing supervision, so that includes training, etc., and supporting supervision. So it follows the framework that the Alliance has been using to date in terms of developing the social service workforce. Many of you will have seen that diagram previously. It's in a number of our documents, and it really is kind of approach that the Alliance uses in relation to the workforce. We then had a fairly small writing group, including our wonderful staff in the Alliance, and a number of our of our interest group members, and they did some really hard work on actually writing the document. We then consulted more widely with those who were part of that special interest group, that supervision interest group. So consultations took place with the wider group to solicit feedback and input. And then the finalization of the document fairly recently and its production. And so I just really want to take this opportunity to thank everybody that's been involved in this. It's been an amazing piece of work. Thanks to all the 64 members of the supervision interest group who did show interest in this and did contribute, and particularly to those who took the time to send us documents and resources and to contribute to the outcome, which we think is a really lovely, a very high quality piece of work in relation to supervision. And we know that it's a long overdue piece of work, and it is something that we are very proud to really be launching today. So I think the last thing I'd want to say is that we're really keen to hear your feedback and on the document, but we'll talk a little bit more about that perhaps later. So the purpose of the guidance document on supervision is to provide guidance to individuals working to provide, manage or coordinate social services. So we really hope it will be of use across the broad spectrum of all the actors involved in the social services. I mean, from volunteers, and I particularly want to stress the need or the supervision for volunteers, because we know that particularly perhaps in COVID times, they're playing a very important role, a really critical role in the work to protect vulnerable populations. The purpose of the guidance is also to define what was meant by supervision in the social service workforce. And so we took some time to develop and come up with that definition. Then we have outlined in the document key elements of good practice and supervision, drawing on resources that have been in place for some time, drawing on research, drawing on other documents and other guidance. This was certainly not something that was that we were making up as we were going along. We were really pulling on what we could in order to ensure that what is included in the guidance is of the best possible practice in supervision. So we also summarised the different forms that supervision can take, and so there's sections on looking at the different models: one-to-one supervision, group supervision, peer-to-peer supervision, and then peer group supervision. And then we've presented some general recommendations that have included specific case examples. We've drawn, as I said, on documented best practices. We anticipate that this will enable greater awareness of the importance of supervision, what it entails, and the significant positive benefits it can have. And I don't think I can stress this sufficiently. And it really, in terms of advocacy, we have to advocate for supervision, but we have to advocate for quality supervision. And we hope that this guidance will help us all to actually advocate better for that supervision and help governments help bodies and our organisations understand the need for and the essential nature of supervision. We are we aim in this guidance to also enable improved supervision practice, and ultimately, of course, this has to result, and this has to have the aim of improved quality of service for beneficiaries. So that is the ultimate aim of the supervision and of the supervision guidance. So I just want to spend a minute just to go through the supervision, the defining of supervision. This took us some toing and froing and some discussion, I think, which was very interesting indeed. So supervision in social services is a supportive relationship. We want to stress that. It's carried out in regular meetings which focus on accountability, well-being, and skill development. Through regular contacts, the supervisor provides coaching and encourages the supervisee to critically reflect on their practice. The ultimate aim of supervision is to improve the service to clients. So here we have a number of a number of sentences that make up what we think is a comprehensive definition of supervision. But of course, we're interested in your views, what you think of that definition, and whether you agree with it or you want to reconsider, although I have to say we did have some discussion on it. So let's go to the next slide. So many of you will have seen a three-legged stool up till now. We've always described supervision as being three-legged, or a three-legged stool representing the different elements, the different functions of supervision. We're proposing 4 legs. So we've got a different type of stool now. We've got a 4-legged stool. So the 4 functions, one is managerial that we're proposing. One is managerial, which is reviewing the workload, performance feedback, reflecting on strengths and weaknesses, and supporting the supervisee. So supporting the supervisee to also undertake difficult work, because we know that the work that everyone is doing in the social service workforce is difficult work. The managerial aspect also helps supervisees understand their responsibilities, and it is about advocating for needed resources for supervision, but also for the work that they're doing as part of the social service workforce on their day-to-day basis. The second leg of this 4-legged stool that we're proposing is developmental. So helping to develop and improve the skills of the supervisee, coaching and practice advice. So this is a really kind of technical role. And then helping them to identify, helping the supervisee to identify preferred what they would like to learn, possible training opportunities, learning methods, learning opportunities, and reflecting on what it is they see for themselves in terms of their future professional role and path. This is also about ensuring they know how to apply learning in practice. Then we have the supportive leg, which is providing a safe environment as part of the supervision session, helping supervisees reflect on biases and deepen their revalue base, empathetic and emotional support being offered to the supervisee, and potentially signposting them towards counselling if necessary. And then we're supporting wellbeing and providing referrals for support. The last leg, which is the new one, that we have seen, and it has come not just out of the heads of those that were writing the document, the guidance document, but it has come from other documents that we've read around and used around the supervision guidance. So the other one is the mediation, and that is about serving as a bridge between the supervisee, other staff members, and the larger organisation. We see that as a role for supervision, and an important role for supervision. It's also about advocating for organisational change. It links with the advocating for the resources mentioned above, And it's about ensuring that staff needs are represented and that there's that link between the staff member and the organisation, and that they're involved in decision making and are able to be supported where there are issues such as complaint procedures that they want to follow. So we'd be interested to hear what you think of our four-legged stool. Thank you. So the key elements of the guidance are, we have ethics and supervision. We look at the advocacy messages, as we were saying, why supervision is vital, why it is so important. And then the guidance also covers the what, who, and the when of supervision. So around those kind of models, and it gives some ideas about who should be potentially providing supervision, you know, what sort of timeframes, etc. It looks at supervisor competencies and training and makes some suggestions around competencies, and then provides models for supportive supervision and a specific focus on remote supervision during COVID. Because we know that that is a major issue at this point. Then it looks at CPMIS or CPIMS Plus and Primero, and the role that that can play in supervision. And then we have an supervision agreement template in there as an annex. And then there's quite a number of additional resources links and a section in the annex on supporting staff well-being, which of course is very much part of the supervision process. So thank you. How do we ask you and would like to see you use the guidance? Well, first of all, we'd like you to download it and to share it. I think Nicole has actually shared it within the panel on the right. And so this is really us launching this guidance document in this webinar. I'm thrilled to do that. So please use it, please share it, please download it, share it, and use it. Use it to strengthen supervision in your own context. And then we ask that, yes, you send us feedback and results to us, and we've given you a contact email for that. And then, of course, join the conversation on the importance of supervision during this week, which is, of course, the Social Service Workforce Week. So welcome to the Social Service Workforce Week, and, of course, welcome to this webinar. Thank you. So I'd like to introduce Kelly now. Thank you very much, Kelly, for joining us. As I said, I really should have put on a webcam myself, and I wonder, Kelly, if you can put on a webcam on your webcam while you are presenting, and I will also. Sorry, can you? Sorry, Kelly. I think I just.
No worries, I'm here.
Yeah, I'm not sure I can see you now, though. I saw you a minute ago. Okay, would you like to start?
Absolutely. So hi, everyone. You may or may not be able to see me. Jane, would you like me to just go ahead and jump in?
Yeah, unless you can fix the webcam issue quickly, but if not, then fine, just carry on.
Perfect. It says that people can see me, but maybe not on your end, and I apologize. But if you can see me, hello, everyone.
Great.
So my name is Kelly McBride. I am a mental health and psychosocial support technical advisor with IFRC Psychosocial Center based out of Copenhagen in Denmark. And I'm here to talk to you guys today about, and Jane and I were just talking about what a complementary kind of project supervision, the missing link, is to the gorgeous guidance document that you all have created. So in collaboration with Trinity College Dublin, the IFRC Psychosocial Center has embarked on a journey that began last year, around October, to create what's called the integrated model for supervision kindly supported by USAID, Bureau of Humanitarian Affairs. So we're really grateful to them for recognizing the importance of supervision. And so the integrated model for supervision is looking specifically to create guidance and tools for mental health and psychosocial support and protection interventions. And we're looking at emergency contexts. And so the integrated model for supervision, and we can go to the next slide, is, it's in its kind of phase 1 right now, and the intention is to really help to equip those working in emergencies to be able to strengthen their MHPSS service delivery through supervision. And so we're hoping that this can be used across different agencies, so it's not just a Red Cross kind of internal thing. We're really hoping that through its design, that it really is applicable to a very wide audience. And so we have had quite the journey in getting this together this first year. And so we can move on to the next slide. And so phase 1 is the end goal is to develop what's called version 1 of the integrated model for supervision. And so again, the IMS is guidance and tools to be used specifically within the field. And so we really wanted to use a participatory design in order to create this guidance tool. We were hoping to make sure that it was really informed by end users, taking into account their best practices, their challenges, and really kind of what they find to be the most useful. And so we have a really amazing advisory group made up of experts, practitioners, academics, folks across the globe who are really passionate about supervision and are really kind of helping to steer the creation of the IMS. We've also done a desk review. We've conducted loads of key informant interviews, and some of you might be on the call today. So we're really just so grateful for everybody's time in taking part in these kind of semi-structured interviews. We've also recently completed 3 different workshops with folks from the field across the globe. I think we had about 33 different countries represented in these workshops. Originally, they were supposed to be face-to-face. As everybody knows, we've had to really change and shift the way that we're doing things these days because of COVID. And so we shifted to a virtual workshop, and they ended up going really beautifully. And we were able to get some really just amazing insights and thoughts from those who are in the field, from volunteer level all the way up to kind of supervising academics, things like that. So we've got kind of a wide spectrum of voices from those who have very little experience with I guess formal academic experience with mental health and psychosocial support, all the way up to those who might be licensed practitioners in their countries. So really great kind of representation. And now we are in the process of launching a Delphi consultation, which is an online consensus building consultation that I'll talk to you guys a little bit more about in a few minutes. But this is all that's going into kind of this first phase of the development of the IMS. We've learned some really interesting things so far, and I can tell that a lot of them complement to what the working group here has already learned. So one of the things that we've learned is that regular supportive supervision that's one-on-one is really something that folks say is the ideal and the best. They prefer that it's separate from their line manager, simply because it gets a little messy when the person providing supportive supervision is also in charge of kind of looking after your attendance and your hours and things like that. And people really kind of strongly expressed that it was harder to be open and honest about maybe mistakes and challenges because they were afraid that maybe it would have negative repercussions in their work. Supervisors being experienced is of course really important. Having that technical knowledge, that clinical knowledge is important, but what was really coming out strongly is that relationship that a supervisor can build, and doing that through being approachable, being able to use great, active listening skills, to be non-judgmental, to be able to deliver feedback in a way that can really be well received. And we heard a lot in the workshops about kind of that compliment sandwich, where giving constructive feedback, but gently and kindly, It's really important as well that supervisors are familiar with the social and cultural context, and this is really important. Oftentimes we see the use of expat supervisors, which isn't necessarily a bad thing, is what our participants have been telling us, but oftentimes if they're not there for very long or they're not very familiar with the context, sometimes the skills and the knowledge and things that they impart might not really work with the context, or they might not be able to really fully understand the situation or what's going on. And so that support, there's a little bit of a breakdown there. And so that kind of goes into this idea of supervisors just being really aware. It's really helpful when they're aware of these different kind of dynamics that come into play, and particularly power dynamics. And when we talked about that supervision relationship, really creating the supportive relationship that's a two-way street. So it's not just about the supervisor kind of coming in and doing their job. The supervisee also has a key role to play in being prepared. It's great if the supervisee is, willing and excited and motivated to take part in supervision. In addition, and this one's really key, is that supervision is really important for promoting well-being. Working in mental health and psychosocial realms, as well as protection realms, it's really difficult content. And so what participants, through our discussions have been telling us is that supervision is really important for helping to protect their own well-being, which is crucial. And so that's also why having access to supervision at all levels was something else that even the most seasoned and experienced supervisors said has really helped them a lot, and something that they really want to see more of within their organization. Finally, a need for more guidance and tools and definitions and trainings, which is why it's so exciting to see this launch today and to kind of continue to contribute more information to the field, because those who are working in the field are often talking about how they really do want supervision. Oftentimes their organizations, it's not budgeted or it's not there. So this advocacy element is really important to ensure that we keep building and creating, different ways to support our staff and volunteers. And so those are just some of the key learnings. We're continuing to learn, and that's the beautiful thing I think about this process, is that we're going to just kind of continue to gain knowledge. And the next sort of step in this is a way that you guys can be involved, but actually quite quickly. The turnaround time for this one, if you are interested, is quite quick. But there's still time to engage in phase 1. So remember, phase 1 is developing version 1 of the integrated model for supervision. If you want to be involved, you can contact my colleague Anya with Trinity College Dublin. Her email is down at the bottom left-hand corner, I believe, of the slide you're seeing right now. And so you have a chance to participate in an online consultation. This can be if you're a supervisor, you're a supervisee, someone who just works in, MHPSS or protection. Maybe you don't even have access to supervision. That's okay too. We really do want a large audience to participate in this online consultation, and it's developed for those of you who are familiar with Delphi consultations. The idea is to really build consensus, and so we're trying to build consensus around different ideas, definitions, things that maybe were sticking points in our workshops and things like that. So if you are interested, I highly encourage you to reach out to Anya today, literally today. I think we're trying to close participation today. So do reach out if you're at all interested, and she can send you more information, and it's just a really great way to be involved. Lastly, I'm really excited to say that USAID will continue to support this really important initiative. So there will be a phase 2 for the integrated model for supervision in 2021. And so what this looks like is taking version 1 of the IMS, which we hope to have launched in around January of 2021, taking that and really continuing to kind of workshop and build it and make it as strong as it can be using a participatory design all throughout. And so if you are interested, if your organization is interested in being involved, please do feel free to reach out to me. I've put my email address down in the bottom right-hand corner there. Do reach out to the Psychosocial Center, Trinity College Dublin. You've got Anya's email address as well now from the previous slide, and we are happy to provide you with more information and and hopefully involve you in the future, because it's really important that we get as much kind of feedback and engagement as possible. That's all for me right now, and happy to answer questions later on during the presentation.
Thank you so much, Kelly. That was really interesting indeed, and I'm really so pleased to see the complementarity of the two sets of guidance that we're developing in the two areas of work. There seems to be a lot of kind of similar messages and similar findings really from what you've been doing and what we're doing. So, but I think your focus on MHPSS and on the emergency context is just a great you know, addition to or you know, partner, as it were, to the work that we've been doing. So thanks so much for that. Suzanne, can I ask you to come in next? And if it's possible, if you can, I will switch off my webcam. If I don't, I'm hoping people can see it. But if you can sort of switch on yours, that would be great. Thank you.
Yeah, thank you, Jane, for the introduction. Hi, everybody. So I'm Suzanne. I'm the case management advisor working with Save the Children in Myanmar. So I'll be giving a presentation on adopting a competency-based approach to strengthen the social service workforce. There has been a lot of gaps, and I think, you know, Kelly has highlighted some of the key gaps in terms of, you know, supervision. And in Myanmar, we really wanted to use supervision as an opportunity to strengthen the social service workforce through adopting a competency-based approach. Next slide, Nicole, please. So just to give a bit of an overview or a background, I wanted to highlight, you know, what are the reasons why, as Save the Children Myanmar, we decided to adopt the competency-based approach. Last year, there was a multi-country review that was done in East Asia and the Pacific region that really highlighted some key issues, you know, around the social service workforce. Particularly around kind of limited efforts to recognize the social service workforce or individuals within the social service workforce, and to recognize it really as a profession, but also to ensure, you know, training and supervision across all levels within the social service workforce. So again, highlighting, you know, importance of working with volunteers to provide adequate training and to recognize even volunteers as paraprofessionals within the social service workforce. There has also been some recommendations, you know, in terms of how do we improve retention of the social service workforce, how do we improve job satisfaction, but also how do we create opportunities for professional development, but also job development for individuals within the social service workforce. So all these kind of key recommendations that came from this multi-country review focusing on East Asia and the Pacific region allowed Myanmar, Save the Children Myanmar, to say, okay, how do we address these by adopting a competency-based approach? So just a bit of an overview on the context of Myanmar. I'm not going to go through the significant, you know, protection issues that are faced by children across Myanmar, but of course, you know, many areas where there's ongoing conflict, lack of access to humanitarian support. This raises a lot of issues for children across Myanmar and makes it even more challenging for the social service workforce to address all these wide issues that children are facing. In 2014, the government adopted and endorsed the Myanmar Social Protection Strategic Plan, where as a result of that, the Department of Social Welfare set up the base for the case management system, or laid the foundations, if you want, and deployed case managers across the country. But even with setting up this foundation, there were still a lot of key gaps in terms. And this is where, you know, NGO CSOs continue to support government by either providing training or deploying caseworkers in order to fill these gaps and to address the wide range of protection issues across the country. Next slide, please, Nicole. So when we say competency-based approach, what is that really? I think so competency-based approach really looks at a practical and systematic approach to training and to strengthening the social service workforce. We will see later what are the kind of structured key steps that we follow to establish a competency-based approach. It also involves, setting, defining set competencies and job roles and job descriptions for your social service workforce. In Myanmar, at Save the Children, we have decided to focus on 3 key roles within the case management kind of system. So we're looking at, we looked at developing, the JDs, but also competencies for case supervisors, case workers, but then also community social workers or paraprofessionals. Competency-based approach also allows you to kind of increase training, and because coaching and supervision is very much embedded in the process, it allows for a more structured and quality kind of approach to supervision. And then 2 key kind of characteristics that I really want to highlight is the assessment and accreditation component of the competency-based approach. So accreditation and assessment, it really allows for participants to gain the recognition and accreditation, not just by attending, a one-off training or a 5-day training, but really based on actual post-training performance and implementing the key competencies as part of their roles and tasks and responsibilities. Next slide, please, Nicole. So this, as I said, is the roadmap to implementing a competency-based approach. So this roadmap, I think, can be kind of adopted by any country program that decides to look at a competency-based approach, and it provides you with a step-by-step process of what needs to be done to achieve certification or accreditation. In the guidance, you can find more details on each steps. For the purpose of the webinar, I will briefly talk through this process. So first, step 1, like I said, is defining clear job roles and job descriptions based on tasks and responsibilities. Again, this is something that's agreed on in country in terms of which are the key roles within the social service workforce that the country program wants to focus on. After you've developed the job roles, the tasks and responsibilities, then you align or develop the key competencies that are aligned with the job roles or the tasks and responsibilities. So what are the competencies needed in order for the participant to implement, their tasks and responsibilities? After that comes the training or development of the training that again, meets the competencies. So how do we develop the training to meet the key competencies? Just to highlight here, in Myanmar, we've looked at a phased approach to training. So for example, we look at a 3-phase approach where phase 1, we take a set of key competencies that we want to focus on, and then phase 2 focuses on a different set of competencies. This is kind of based on learnings where sometimes we tend to overwhelm participants by doing one-off training where we just provide them with a lot of information, a lot of knowledge, and then expect them to go and implement post-training. So we thought a phased approach to training will be more effective and more efficient in terms of really allowing the participants to grasp what we're giving them in the training, but also to implement their learnings on the job. So after trainings are completed, there is supervision and support on the job. Again, this is a process that's really embedded within the kind of competency-based approach. And then the supervision and support, would be the kind of key tools that Jane has briefly also described, in looking at the different approaches of supervision, whether that's one-to-one kind of supervision or group supervision as well, in order to ensure that we're continuing to assess what are the gaps in terms of knowledge that we need to provide to the participants of the competency-based approach. So it is a process, and it's not a one-time training or one-time supervision or support that's provided to the individuals or participants of the scheme. What I want to focus on really is in the last two steps, which is completion or meeting the competencies, but then also the certification. So in terms of completion, this step really entails that, you know, the social service, the individual or the participant of the scheme has met all the required competencies for their role. How this really happens is that you would have trained assessors in country that will be responsible, you know, to provide participants that will be responsible, for supporting participants to provide evidence that they're meeting their competencies. This would be used to the different, you know, supervision tools, and we will see later how the role of the assessor and supervisors really complement each other. When the individual participant has provided the evidence, then the assessor can either, you know, sign off that yes, the participant has met the competency, or what are ways in which we can work together to ensure that you meet the competencies that you have not yet met. So this is kind of where, you know, the supervision role really comes into play in terms of how do we support for the participants so that they're competent in their roles and they receive the needed certification or accreditation. The final step is the certification, and this is where you receive the recognition that you have met all the required competencies within your role. Nicole, if you can go to the next slide, please. So in terms of accreditation, which is the final step, we really want to show or test, if you want, in Myanmar, how accreditation can really be a motivating factor for participants. As I said before, you know, the studies in East Asia really highlighted, you know, how we need to work on improving job retention and job satisfaction. So we're hoping accreditation, you know, can really allow for professional development of the social service workforce, career development, especially looking at, you know, volunteers and how volunteers are being highlighted a lot more, as Jane has already said, in the COVID-19 response. So how can we really support volunteers in order to ensure that they receive the needed support, but also to allow for their professional development? It's important that we look at accreditation to be embedded within the government structure or an external assessment center. This is something, you know, as Save the Children, we are closely working or collaborating with the Council for Awards in Care, Health and Education, or i.e. CASH. They've been supporting us closely in terms of training assessors in country, but also how do we establish an assessment center that could provide recognition and assessment for the social service workforce. Next slide. So this kind of just depicts, you know, what I was highlighting in terms of career development or potential career path. Here you can see, you know, sometimes you start from the very basic of having community groups that kind of respond to protection issues. That then from these groups you might have trained volunteers. With the proper training, and supervision and support, these trained volunteers can eventually reach to become, you know, NGO caseworkers or government caseworkers and even case supervisors. Next slide, please, Nicole. So, you know, finally, we just wanted to kind of highlight how supervision and assessors really complement each other. So how do we ensure that they complement each other within the country programs? In a lot of countries, we already have supervisors in place. So of course, we don't want to duplicate any system or create a duplicate system that may conflict with having in-country supervisors. So given that assessors use the same tools, use the same approaches as supervisors, in Myanmar, some supervisors will also be assessors. This really depends on the country context. The end result ultimately is quite different for supervisors versus assessors, because assessors will really be supporting participants or individual to help them, achieve their roles and responsibilities to get that last step, which is the recognition or the certification and accreditation. Just some key challenges we also wanted to highlight, particularly around implementing a competency-based approach in humanitarian settings. There are some operational challenges, particularly given that this is a process-oriented approach. And we know in conflict settings and humanitarian settings, this may be a challenge, particularly when looking at short-term funding. Also, in terms of setting up accreditation and assessment centers, who gives the accreditation assessment is particularly important to explore in the context. It's important to consult with the social service workforce in country to ask them as well what is valuable for them in terms of who they receive accreditation and certification from. And then finally, as we know, providing evidence may be a bit challenging in terms of documentation that we need to provide. So in some contexts, especially in some regions in Myanmar, there is low literacy levels of the social service workforce, particularly when we're looking at volunteers. So this may become a bit challenging in terms of how they provide evidence that they're meeting their competencies. And this is where the role of the supervisor or assessor becomes really key in supporting the participants of the scheme to really be able to provide evidence that they're meeting the competencies and help them to even document this evidence. Next slide. So just to summarize or bring everything together in terms of why competency-based approach, might be inappropriate in a context like Myanmar. Again, it just helps, define roles and responsibilities. A lot of times we sense that, individuals within the social service workforce have job roles but are actually not clearly defined and not clearly structured. It also allows for a more structured approach to training and capacity building, but also allows for on-the-job training, assessment that can eventually be accredited and the individual to be recognized as competent within their role, which might be key in terms of providing that motivating factor, but also job satisfaction and then continued support for job development and professional development. Thank you very much. I will hand over to you, Jane.
Thank you so much, Suzanne. So I think I'm going to. So this really focused in on the kind of development of supervision. So when we go back to those three elements of planning, developing and supporting supervision, I think thank you very much, Suzanne, for really kind of presenting on the kind of developing and the training and certification side of supervision. So I'm sure that's given people some inspiration on that front. So I'm going to ask James now. We're going to keep the questions, although please continue to add your questions into the questions box and we will address them at the end. So James, yeah, can I introduce you? Can I ask you to present now? Thank you. If you can turn on your webcam, that'd be great.
Yes, I've done. Maybe Jane, you can't see. I hope the others can be able to see me. Yeah, so thank you very much and welcome for this presentation from Mwendo. That will be,
James, can I sorry, James, there's a little bit of a sound issue. Perhaps if you were slightly further away from the microphone.
Yeah, so thank you very much, Jen. Hope you can hear me well now.
Yes, that's much better. Thank you.
Yeah, so thank you very much. Team, welcome for this presentation from Wendo project. I'm James Kidhui. I'm a program manager for Wendo project in Nairobi. I'll be walking you through mentorship and coaching of social service workforce for improved OBC outcome. Running through Wendo experience, Wendo being a project that relies heavily on parasocial workforce to implement quality services for orphans and vulnerable children in Kenya. Next slide, please. Yeah, so in my presentation, I'll be walking you through why we found it tenable for us to come up with a coaching and supervision approach. I will also take you the steps that we went through in developing our coaching and mentorship guide. And later on, I'll also walk you through some of the benefits that we have realized from having that mentorship and coaching guide. And finally, I'll also discuss the lesson that we learned from that. So a brief background of Wendo. It's implemented in 17 counties in Kenya. So we can see the map of Kenya there, and the areas that are shaded, they are where that we are working. And we are impacting the lives of 432,780 orphans and vulnerable children that are in 212,893 households. And you can see we rely heavily on case workers. We have 8,803 case workers. Those are parasocial workers that are working at community level, supporting these households. And we also have 217 case managers. So that is to say that Wendo relies heavily on a case management approach to service delivery, and with ultimate aim of increasing access to health and social services for OBC and their families, also strengthening the economic status of the household, and also ensuring that we have strengthened systems that can deliver proper child protection and welfare for children. Next slide. Nicole? Yeah, so as had said earlier, during our normal support supervision and donor visit, we observed some needs to strengthen our coaching and mentorship approach due to realization that our parasocial workers, that is the case workers and the case managers, required more support. And also to ensure that there is stronger supervision and mentorship of the social workforce that you're working with at local implementing partner level. There was also need for capacity strengthening among LIP staffs and supervisors on mentorship and coaching. Also, we needed a coordinated approach to organizational capacity such that each and every cadre that is working out there knows their roles very well. They can articulate what they need to do on a day-to-day basis, and they are supported adequately to continue performing. Then there was a need for institutionalized accountability mechanism at LIP level to optimize OBC outcome. That was very critical. And then we realized that empowered social workforce at all levels will yield better outcomes for service delivery. And therefore, we had to embark on a process of identifying those areas that we need to work on to improve our mentorship and coaching as a project. Next slide.
James,
yes, so,
while we're changing slides, James, sorry, can I just check? Is there do you have a device that's near you? Because we're hearing a bit of an echo, or I am at least. I wonder if there's another device that's very close. Sorry to bother you, but if we could avoid the echo, it would be great.
Okay, yeah, so maybe it might be the office because I'm in the office, so I hope I'm now clear.
That seems better. Thank you.
Yeah, so I wanted to walk us through the processes of developing our strategy and our mentorship and coaching guide. One of the things that we did was a need analysis. That was to analyze the root causes that led to our parasocial workers and social workers not being strengthened enough. And for us to be able to do that, we came up with teams starting from the senior management level that was meant to coordinate all the processes to ensure that our mentorship and coaching is quality enough. Then we formed some other smaller technical teams that involved other staff and also local implementing partner staff. And then we had a wide consultation and feedback from LIPs and government. You realize that this was an effort between Wendo and the government structures of Kenya, especially the ones that are working at the county level, that being the Department of Children and also Department of Health that we are working very closely with. The developmental process, we had to gather responses from all these teams, and this now generated Wendo coaching and mentorship approach. We came up with an approach that we'll be using, and I will say that this approach basically it's even aligned to the guide that we have just launched today. Because it has all the key functions to improve quality mentorship and coaching. And then finally, during the developmental process, the team put together the coaching and mentorship guide that had very clear roles for each and every cadre and timelines and when we should be able to collect information about those areas that the cadres are supporting on. Then we did a pilot and testing. We did the sharing of the approach and guide with project technical team for feedback. So everyone reviewed, including the government, just to look at is it tight enough to be able to provide the quality mentorship and coaching. And then we piloted in a limited scale within 2 counties first to be able to see what results or intermediate result it will yield. And it did very well. We saw that there was tight and coordinated supervision in those counties, and therefore we had to roll it out to all the other 17 counties that we are working in. In a nutshell, the strategies that we used was partnership and collaboration, ensuring that we are bringing on board everyone, including the government, the local implementing partners, and then the two-way feedback mechanism, which is very important from the people who are being assessed and mentored and the person who is mentoring. It's important for them to listen to each other. So the moment they listen to each other, then that feedback mechanism is very, very critical. And then the teamwork and delegation, ensuring that we were working together as a team, and the supervisors and the supervisees are jointly undertaking their role in a consistent way. Then we continue to do the SWOT analysis, that is the strength, weakness, opportunities, and threats, looking at what strength each and every cadre has, what are the weaknesses, what are some of the opportunities and threats that can lead to them not doing the right coaching and mentorship. Next slide. Yeah, so as I had said earlier, so through that process, we initiated also a process of just developing a training guide for especially the case manager, because this is one of the integral cadre in terms of supporting case management and especially supervision of the parasocial worker, the community health workers that we are working with. as a project. And this guide, we ensure that it entrenched the issues of administrative case management, that is leadership. And I know these are some of the functions that were explained earlier in the presentation of launching of the guide. And also we ensure that these case managers can be trained on how to reflect on some of the learning from the practice. So as they continue working, they can reflect on what are they learning from, what are some of the issues that they can be able to pick, and they can use that even to impact more on the supervisees. Then personal support, ensuring that they provide emotional support, especially the community health volunteers. And also they were doing the mediation role, ensuring that they can be able to mediate between the community health workers and other staff, because each and every staff would want to use the community health volunteers, and therefore for us to ensure that this quality work that have been done by this team, then it was important for the case managers to mediate and ensure that the work, there was work balance from all the other staff. And then professional development, ensuring that even the case workers can be able to go up the ladder in terms of even becoming the case manager themselves, or taking up some other role in the LIP. So next. Yeah, so this is a sample of site mentorship and coaching guide. And you can see it has all the cadres that we are working with at down on the ground at the county level, starting from our cluster leads who are working closely with the Department of Children's Services, Ministry of Health, Agriculture, and all those departments, and they have their own role, what action they're supposed to be done. And then this guide also shows a section where we need to show if that role was done or not done. Then it goes down to the project coordinators. These are the people who are working at the LIP level, and we have their role and action shown, including maybe sharing of monthly summary OVC served reports, up to ensuring that they can sample at least some of the tools that the case managers are using to monitor CHVs. Then we have even the mill officer. What is their role? So the role of each and every cadre is well set and well defined, so that they can provide the relevant and quality support that is required. Next slide. Yes, so you can see all those cadres going down to even data assistants, then social workers, what they do, and then we have the lead CHVs. Lead CHVs are the lead parasocial workers. We have grouped parasocial workers, and they have someone who provides them with relevant support every time. And then finally we have the CHVs, who are the parasocial workers. What are they supposed to do? They need to visit household on a monthly basis. And during the training of case managers, they are given more information on how to continue guiding the CHVs in terms of household visitation, looking at their work, what is their workload, so that we can also be able to avoid burnout for these parasocial workers, because they are very critical for the project. So next slide. Yeah, so from the whole of that process, developing our mentorship and coaching strategies, and also having a guide, we have realized a lot of improvements from where we were in 2018 when we were beginning the project. And what this has done is it has supported us to have a pool of case managers who are providing mentorship to case workers. They have been trained, they understand what needs to be done, and they are providing quality supervision for the case workers. And then we have now the guide that is supporting all these processes, and we have a better coordinated social workforce as a project. And we have a standard also approach to mentorship and coaching that is also being used, and the government is very apprehensive about it because we are working together with them. And then we have realized that there is a regularized house of visit and improved delivery of services. And partnership and collaboration was one of the key strategies, and it has worked very well because the government has come in to also work together with us. And these are also informed reduction of even some of the caseload for our caseworkers, ensuring that we can give them what they are meant to take care of in a quality way, and this feedback is coming from them on a regular basis. Then this also supported in simplification of the OVC service delivery tool for the project. Next slide. Yeah, so as we go on, I know the next slide will be able to show us some of the quantitative impact of this. One of them being there's improved enrollment of the beneficiaries into the program, which was one of our key mandates, and that is one of the areas that we were performing poorly at the beginning of the project. And then there's other service areas like birth certificate. There's a lot of improvement in that. Nicole, next slide. Yes. So and then in conclusion, we can see that root cause analysis to capacity gap is important as it helps in design of result-based strategies, and we can see from this process. Then collaborative approach is very key in terms of ensuring that there is ownership from the stakeholders, and structured supportive supervision for social workers is a key driver for quality OVC service delivery. And it's important for us to build the capacity of case managers as supervisors, because that will help also build the capacity of community health volunteers. And this in turn will ensure that there is structured and empowered workforce to continue providing services at community level. And then I can say that this process was very critical because it generated a conversation for a need of a county level supportive supervision guide. I know even the government will want to pick, is picking this to shape it into policy framework to ensure that we have a very structured social workforce and very empowered support supervision. And I know from the guide that we have launched also, I think it's something that we can be able even to share that will help even in putting some of these areas. And then lesson learned from this, supervision is a central element to effective social workforce practice. That is very key and straightforward. And then partners are amenable to improving supervision when the process is collaborative and strength-based. So those are some of the lessons that we learned from the whole of this process. And therefore, this process was very critical for our project. And we have seen that this is something that we can be able to share with others to be able to adopt and scale up where we have community-based interventions. Thank you.
Thank you so much, James. I think it was just so interesting to hear you illustrate the importance of supervision and coaching being at the core of the improvement that you've made in the quality of your program. I also think it was really interesting. So we've all, I think, talked about the importance of community volunteers at the moment, and especially in relation to supervision. And I do feel sometimes we forget about volunteers. So I think that's been mentioned a number of times, and something that we really need to consider in terms of priorities. I thought it was really one of your points, which is still on the screen actually, which is about supervision being the central element to effective social work practice. I think that's exactly what this webinar and what the guidance and what we've all been talking about. So thanks so much for that. I want to now open up really for people to, yeah, Asante Sana, for people to ask questions. We do have some questions already, and we can start with them, but please keep the questions coming. So maybe the first question that we could address is, I think I was asked, Suzanne was potentially going to ask answer a couple of questions, one of which was, how will this approach be integrated into higher education training? And then there was a question related to coaching and competency-based in the competency-based approach. Suzanne, are you able to take those?
Yeah, sure, Jane. So first, the question on kind of higher education and whether, you know, competency-based approach can be used or will be integrated in higher education. I mean, for example, in Myanmar, the reason we've adopted a competency-based approach is because there is no professional degree around social work in Myanmar and country. Actually, across the country, there are 3 trained social workers in country that have a professional degree in social work. What competency-based approach, and I think even higher education institutes are looking to adopt more of a competency-based approach. It really focuses on the job kind of approach and learnings that are done kind of on the job that really allows for growth within the job and the day-to-day tasks of the individual or the participants. And I think this is an approach that has been adopted by higher education as well in some instances, where they're really looking at kind of a competency-based approach and more of a practical approach than kind of more of a theoretical approach to learning. Around the question on, you know, coaching and kind of supervision, so they come hand in hand in the competency-based approach. For supervision, you know, in the past in Myanmar, it really has kind of focused on troubleshooting, you know, for complex cases, supporting the caseworkers in terms of how to deal or address with high-risk cases. But looking at the competency-based approach as more of a process, the coaching component, you know, also really plays a key role in terms of how we really coach the participants of the scheme, how we allow them to assess their gaps in terms of training and capacity gaps, but how we provide that kind of ongoing support. So it's not just a supervisor-supervisee kind of role, but then the coaching role really plays a key component as part of the process.
Great, thank you very much. So there was a further question, this one for Kelly perhaps, around power dynamics and examples of what we mean.
Yeah, it's a great question. And so within supervision, there are the inherent power dynamics between, and it just comes by virtue of the names of the roles. So you have supervisor and supervisee, and that's already kind of inherently a little bit of an imbalance there. But then there's a lot of other elements that can come into play. And so some of our informants talked about the role that their culture might play. So one example of this was a Western supervisor being really aware that a lot of the techniques, a lot of the approaches and things like that that she was using in a humanitarian context were quite Western and maybe didn't fit as much into the environment, and that she might be somehow unintentionally imposing her ideas, her beliefs, what she thinks is the right approach on those that she was supervising. And I think that took a lot of reflection and insight on her part. We have also heard a lot about, you know, the role that gender plays, and that can play a huge role in some cultures and contexts. You know, the kind of gender norms that are already present can then play out in a supervision relationship. And so what people told us to be most helpful when there were these imbalances was just to really work on building that strong relationship between supervisor and supervisee or supervisees, so that it could be addressed kind of openly and honestly. And that was usually a really key way to overcome what was going on, and just getting feedback from those that you're working with to really kind of work through different things, because it's normal. We're all human, right? So there are going to be different biases, ways that we were trained, ways that we view things, and so just creating that relationship to where it can be openly discussed and you're constantly reflecting was what we've heard to be the most helpful when that does come around.
Great, thank you very much, Kelly. Okay, we have one more question at the moment. We're very happy to take more. So this one is around planning the implementation of this supervision and coaching approach. How do you involve leadership development to ensure that we have the right kind of mindset to build a learning culture? And presumably that means a culture of that includes and promotes supervision and coaching. I wonder, James, if you would like to take that. James, would you like to say something about how you got leadership buy-in for the approach to supervision and coaching?
Yeah, so thank you very much. What I want to say is basically supervision should be an all-inclusive process, and the leadership of the project was very particular in ensuring that we can be able to improve those areas because they are affecting our performance. And through our root cause analysis, we were able to identify the area of supervision as one of the contributors to non-performance of the project. And therefore, after doing that assessment and sharing those findings with the management and critically analyzing them, that allowed them to be part and parcel of that, because they wanted to see those areas improved. So we need to have a very clear root cause analysis, analyze it, and be able to share with the leadership for buy-in, and also with even the government people that we are working with. So the moment that is put very clear, explained very well, then it's very easy for them to jump in and support the whole process.
So James, there's a further question here, which is around how do we finance the coaching approach? I wonder if the two questions are a little bit related, that if you have buy-in from the leadership, then perhaps they're more willing to finance it. But how did you manage to budget for your coaching and supervision, the roles that you are introducing?
Yeah, so I like your first response. Basically, once you have had a buy-in from the management, it becomes very easy to entrench it in your work plans and budget, and it will be able to go through. And also, the donor will be able to also accept that aspect, since they are also part and parcel of the people who came to the ground, and just in the analysis they say that we need to improve on our supervision of the cadres that we are working with, and therefore the moment that is done, and when a clear root cause and assessment is done, then share the finding of that assessment, specifically showing the critical areas that need to be addressed. Then it's easier for it was easier for the project to lobby for that to be included even in the work plans for the local implementing partners, and also having finances to be able to run case management training curriculums that entrenches the importance of supervision.
Okay, great, thank you. So I have a question here about how do you train the coaches? Are they external professional coaches or are they internal and act as coaches next to other tasks they perform? So I know, Suzanne, I don't know if you want to say something about the coaches in the program in Myanmar.
Sure, Jane. So in Myanmar, what we have done is looked at a group of individuals that we didn't call them coaches, but we called assessors. So together with CASH, the organization I mentioned during my presentation, we developed a training package that looks at training assessors in terms of, you know, how they provide the coaching, the mentoring to the participants of the scheme. There is no kind of, if you want, strict criteria for us in country, but just to kind of make sure that whoever is conducting the assessment, of course, or the assessors or the coaches have the technical capacity around providing, you know, guidance, particularly on child protection case management for the Myanmar context. So they're trained individuals, you know, on child protection, have worked in the sector for quite a number of years, which then allows them to kind of provide the guidance and support to the participants in the social service workforce. So I think this is really depending on the context in terms of who they are supervising or who they are coaching. In Myanmar, we tend to avoid the word supervision, so we use more kind of coaching and mentoring, in terms of terminology, only because supervision can create a bit of sensitivity within the process. I hope that answers the question, Jane.
Yeah, thank you very much. Okay, I'm just looking at other questions. So Kelly, there was one that I thought you might pick up on the line management and supervisor roles and our views on whether in fact they should be combined or better separated.
Yeah, so the research we've been doing this past year, it's been quite clear that if possible to have two distinct and separate roles, that's the ideal. And that's just because, you know, people are reporting that, again, that kind of power dynamic of having your manager also being the one to provide supportive supervision might feel a bit vulnerable. So if possible, to have those as two separate roles. Oftentimes that can be quite difficult, especially if we don't necessarily have the budget for it. And so this is the area where just having really clear kind of job descriptions and kind of boundaries around different things, I think is really helpful. And I'm not sure if that answered the whole question or just part of it.
Thank you. Thanks very much, Kelly. I'm going to ask James about the next question, which was around how exactly do we organise the coaching sessions, and is it on demand? How is it organised?
Yeah, so thank you. Yeah, so in Mwendo, as I had alluded earlier, we have grouped our parasocial workers. Those are the community health volunteers, and they have a supervisor who is a case manager. So the case managers are well trained. As I had described, we have a guide for training the case managers on the areas of coaching and mentorship. Then every case manager works with their the parasocial workers that they have been assigned. So you'll find that some case managers have around 30, others have 20. It all depends with the geographical areas where they are working. So they are mandated to continue coaching and mentoring those parasocial workers. Then at project level, we have a cadre that we call project officers. The project officers are assigned a group, they are working with local implementing partners. And in those local implementing partners, now we have this a group of social workers, the ones that we call case managers. So the project officers is mandated to continue providing mentorship and coaching for the case managers. So it's cascaded like that. So we have parasocial workers that are under case managers, and then case managers who are under project officers. Then the project officers, we have a case management advisor who does provide mentorship for project officers on a regular basis. So that is how we have cascaded that, and we ensure that there is entrenched quality in the mentorship and coaching processes. Yeah.
Thank you. There was a question which you might also want to answer, or I mean, which was around the difference or how you saw supervision, coaching, mentoring. Others might want to actually add any ideas that they have as well.
Yeah, so I know what I will say is that I know we use mostly the coaching and mentorship. And basically we know supervision is an integral part of coaching and mentorship. But why we will not want to just have that word supervision, it will look like it's just managing a group. But what we want to do is ensure that this group is supported. Basically, even the one that we can use is supportive supervision. It's supported on a regular basis to be able to deliver on their mandate. So I can say that supervision is an integral aspect of coaching and mentorship.
Okay, that's an interesting perspective on it all. I know that we're constantly, I think, redefining the terms. Kelly, we have a question about reflective supervision. I don't know whether you feel you can take a look at that one. It's does that form of supervision, which is reflective supervision, have a place here? Is the time, meaning, you know, taking the time to understand the impact of the work on the social service workforce?
Mm-hmm. Yeah, so I think that it absolutely has a place and key importance. But I don't know that we are in a space to where that type of supervision, so having the time and the space carved out to really be able to get into that reflective space, I don't know that it's always prioritized. And that's again where the advocacy element really comes in strongly to donors, to organizations, that supervision is prioritized and that there is space for regular, consistent supervision when possible, so that, you know, all kind of levels of the social service workforce do have the opportunity to reflect on their work, the meaning of their work, on their lives, the difficult challenges that they might face. So I think that it absolutely has a place and a space, but I don't know that in practice we're seeing it as often as we would like.
Thank you so much. So at this point we have 2 minutes left. So it really is, it's time for kind of closing, and I'd like to thank everybody very much for being part of this webinar, for your questions and all your contributions. I think there's one more slide I need to go over. I will go over, Nicole. So we have some links here for you. Please, first thing to do is to download the guidance document and admire it and then use it. And then view the full recording and the presentation from this webinar and the previous 38. If you have some time during these COVID times, they are available on the Alliance website, and I'm just reminding everybody to become a member of the Alliance and continue the conversation with global colleagues. And remember, this is Social Service Workforce Week, and please join in and read the blogs. But thank you, this has probably been our kind of key event of the week, so very happy to have been involved in this and very happy to have you on board. So I hope you enjoy reading and using the supervision guidance, and do share your feedback with us. But thank you to everybody, thank you to all the presenters, to James, to Kelly, to Zazan, and to Nicole, who is working so hard in the background to keep this all going. Yeah, have a very good day, everyone. I'm saying good night from here. So thanks so much. I'll say goodbye now. Thank you.